Well, welcome to this update, and we're going to start off by looking at the United States. And I want to look at a few countries in today's update. Now, we looked at some fairly detailed data from the UK in the last video. And UK in some ways is fairly typical, because what we're seeing now is countries have locked down quite extensively. Of course, we can't stay in that situation, so they're starting to open up now. And the big question is, to what degree will this opening up and this reactivation of social and economic activity impact on causing new cases? So it will certainly cause new cases. It's going to increase the R value. The case is, how much does it increase the R value? Now, I think we can keep it below 1 as long as everyone behaves appropriately. So we need that 2 metre distance. 2 metres distance determines our existence, especially indoors. We're at much greater chance of catching this virus from an infected person inside than we are outside, because outside the air is so diluted. So people say to me, if there's virus outside, do I have to shut the windows in the house? No, you do the opposite. You keep the house well ventilated, because outside the viral load is so diluted. So it's inside where people are most at risk. In public transport, in supermarkets, in shops, in public areas. This is where they're most at risk. Partly from the viral particles in the air from people's exhaled air, and also partly from the viruses that have dropped onto surfaces and they can get and contaminate their hands with. Or I can contaminate my hands with and get myself contaminated. So let's keep everywhere as ventilated as possible. This is really simple stuff. If you're relying on air conditioning, get the engineers to check on the quality of the filtering. But let's get plenty of fresh air. It's warmer now in this part of the world. We can open the windows more, we can have more ventilation. Plenty of fresh air blowing through, reducing any viral loads. We also need to maintain our discipline for very good hand hygiene, especially when we come into the house. Thorough washing of the hands after we've been in a public place, certainly before we touch our face. The good hygiene measures. So keeping the virus diluted outside by being outside as much as we can. Good hygiene measures when we come in. But sometimes we do have to be in a confined space. And I'm totally convinced, having looked at the evidence, and I've done about 4 videos on this now, you can go back and look at it, that if an infected person is wearing a mask, they are protecting those round about them. But of course, we don't know who all the protected people are, so everyone should wear a mask in public places. It costs nothing. This is so cheap, and yet it could be potentially a major intervention, greatly reducing the R value, the reproductive value of this virus, stopping people getting infected, keeping this curve nice and flat, where we can cope with it much better. So that's kind of globally where we're at. Now let's look at some specific examples. I want to start with the United States. Now, a lot of new cases in the United States. Now, there's still a lot of other countries, Belgium, for example, which have many more cases per capita. So the spread could be somewhat slower in the United States, because although it started in city areas, it's now spreading more in rural areas, and I believe it will carry on spreading. So unfortunately, I think we see this number rising over the next weeks and months. And basically, by the time you're watching this video, it's sad to think that there'll be 100,000 deaths in the United States. And it's a simple fact, there is more to come. Now, like me, you were probably bemused, distraught, upset, what's the word, to see the social interactions going on over Memorial Day weekend. It was a bit of a party for a lot of people, and there was very close contact. Now, on the last video, we did show people in a swimming pool, and they were close together, and the risk there is from the air. Now, the swimming pool would be chlorinated, and the chlorine will kill the virus stone dead almost straight away. So I'm not worried about it being spread in water. But of course, whenever you've got a lot of young people together, you're likely to have much closer physical contact as well. So I was more concerned about the physical contact and the closeness. So even outside, we still need this 2 meters distance. If you're talking to someone 3 meters away outside, basically you're pretty safe. because you're outside and the virus is diluted. So that was the main thing about those swimming pool pictures, just people being so close together. And there was a lot of other examples of this. And to be safe, a lot of these people have been advised now to isolate themselves for 14 days. We'll see what happens on that. So there's going to be a delay as a result of this weekend, then there's going to be more cases. Now, there's been studies just done in my country about this Cheltenham horse racing weekend that happened way back in whenever it was, March, I think. And it was obvious then that there was going to be cases caused by that. And I said that on this video, but it went ahead anyway, because we have this delay. And it's going to be the same here. So these social interactions will feed through into more cases, just that there's going to be a delay. Typically, the incubation period is about 5 days for this virus. So we will start seeing more cases in the next few days because of the interactions over these weekends. And Arkansas, for example, has warned about a dangerous second peak. Not so much a second peak as a continuation of the current peak, really. And we looked at Montgomery the other day, and in Alabama, the cases have increased dramatically. And the mayor announced yesterday, that 80% of the deaths that occurred in Alabama had occurred in May alone. So deaths increasing in Alabama, indicating that the spread of infection had increased before that. Now, the Centre for Disease Control has advised people to wear masks, as I've just said. That's why I went on about it. In public places where social distancing is difficult, especially if someone is potentially infected. And of course, anyone who doesn't know they've had the virus is potentially infected. So they could be symptomatic or asymptomatic. So the Centre for Disease Control says wear masks. Now, I get a lot of people writing in saying, look, is this the same Centre for Disease Control that dropped the ball on testing? Or if I say something about the World Health Organization, is this the same World Health Organization that completely hashed up the first 6 weeks of this pandemic control in some people's views? And the answer is, yeah, it's the same organization, but that doesn't alter the fact that they've got brilliant people working for them. We have to separate the organization from the brilliant people that are giving advice. Yes, the organizations have hashed up. The CDC's hashed up. The World Health Organization hashed up. But that doesn't mean to say they don't give good advice now. And if you look on the CDC website and actually read what they're writing, it's absolutely brilliant stuff written by brilliant people. So don't throw the baby out with the bathwater, as would say in the UK. Just because the World Health Organization and the CDC have messed up in the past, doesn't mean to say they haven't got good stuff to say now. They have. And they're saying wearing masks. And it is such a tragedy that this seems to have become a political issue. What is political about wearing masks? This is pure science. This is the physics of the way the air comes out of your mouth. It's nothing to do with politics. If an infected person wears a mask, they're less likely to infect the people round about them. So that's simple. Not interested in the politics. Don't make it political, please. Just get this curve flattened. And that means wearing a mask in public places. It's a pity this isn't. Some places in the States it's mandated, some places it's very good, but it's become political, and that's just not, to be quite honest, it's not acceptable. It's not acceptable that it's become political. This is a scientific matter. Sorry, you're going to see that later on. This is a scientific matter, and we should keep it that way. Now, South Korea is interesting for a number of reasons. Now, we know South Korea did brilliantly well with targeted testing, tracing, isolating. They did very well at the start of this pandemic. They've kept the cases down and they've kept the deaths down, so that remains good. But they had 19 new cases on Monday, and I've got 20 new cases there, but I'm pretty sure that was 40 new cases on Tuesday. Yeah, it was 40 new cases on Tuesday. It was 20 more. So they've had 40 new cases on Tuesday. So we see 60 new cases in 2 days in South Korea, despite this massive early success. This shows the virus has not gone away. It's still there. And it has to be actively suppressed, actively kept down. So there's a lesson for us all in that. Things are a bit better now. Cases are down, deaths are down, but it hasn't gone away, nor will this virus go away. And I've no time for people that say this is on the way out. It's not. South Korea proves this. It's still around. There's been reinfections. This virus is not going to go away until there's herd immunity generated by a lot of people having caught it, or vaccination. Until then, there's going to be a risk of resurgence, as the Korean data amply demonstrates. Now, it was linked to an outbreak at a logistics centre, which is presumably where they post things off. And what the Koreans do is they've kind of swooped on this. So 3,600 people are now isolated and being tested. And this is the new strategy in the UK. So we test, we trace, we isolate people. Test, track. So you test them, you track them to see where they've been, and you trace their contacts. And the South Koreans are doing that. So I don't expect this to spread. But what it means is we need to stay vigilant until this virus goes away, and it hasn't gone away. And if it hasn't gone away in South Korea, it certainly hasn't gone away in the United Kingdom or Germany or France or Italy or Spain. And this logistics centre in South Korea is taking the strongest disinfection measures. So they're isolating the virus in the people, and they're killing stone dead any virus that could be breathed out and coughed out by the people in the workplace to make that clean again. So, yes, we're going to have new clusters of cases. And again, the philosophy in my country now is moving towards not a globalised lockdown for the whole country like we've had, but a more selected one. So if there's an outbreak in a particular factory, the factory will be closed down. If necessary, an area or even a city can be closed down, while everyone else just goes on getting back to work. It's this more targeted approach, which is what they're doing in South Korea with this new cluster. And they will get on top of this. But it does show it hasn't gone away, and it does show the need for that targeted testing, tracking, tracing strategy. Now, I'm not going to go into a lot of detail in Sweden, but the death rate has been higher in Sweden for the last week or two than other countries in Europe. In fact, at the moment, it's the highest death rate in Europe. The Swedes have admitted that they have made mistakes. But there again, haven't we all? But the Swedes didn't do too much shutting down. And what is disappointing is only 7.3% of people in Stockholm have tested positive. So despite the strategy that Sweden has been pursuing, firstly, it seems that not too many people have been infected, which is surprising. But there again, it's not a country we can draw ready conclusions to. Having said that, the death rate in Sweden is now increasing, and I expect to be high for the next week or two. Or maybe slightly longer, unfortunately. But herd immunity has not happened. You know, we need 70%, preferably more, 70% of people infected for herd immunity. About certainly 60 to slow things down, and then 7. Well, it'll slow. The more people you have herd immunity, the slower it's going to be. But to have proper herd immunity, we need 70%. So they're nowhere close. So, surprising more people weren't infected, which is good, but disappointing because nowhere near herd immunity yet in Stockholm. Just 7.3% people testing positive for the antibody test. Now, South America, the World Health Organization have said this is now the new epicenter, and things are looking really quite bad throughout Latin, Central and South America. Rapid growth of cases in Central and South America. So obviously Peru, Brazil, Mexico. Large countries that we're very concerned about. And the World Health Organization have said expect acceleration in Guatemala, El Salvador, Nicaragua. And that now is not the time to be relaxing restrictions. But it is the time to give these countries all the tests that they need, to give them all the PPE that they need, to give them the educational, infrastructural support that they need. And it could even come down, as we've been considering today in our video I'm going to publish tomorrow, that in some of these areas food could actually become a problem as well. So very much a local problem, but one that the whole world needs to take some accountability for, I feel. Certainly they need millions of tests. Let's hope we start sending them millions of tests. Now, Brazil, cases, deaths increasing. outbreak greatly accelerating. Highest daily death toll now, so the amount of deaths per day are increasing. It's looking on a very much, and we looked at graphics a couple of days ago, very much upward trend in Brazil. And yet I saw a video today that Rio de Janeiro is reopening. I saw videos of busy streets today in Rio. I'm not saying there's not a need for that. The people needed to work. It's not a rich country. The people there, some people were hungry. And yet it does mean there's going to be more spread. That means there's going to be more deaths next month. The United States has banned travel from Brazil. Not surprisingly, to be quite honest. Brazil has not handled this well at a senior political level, as I'm sure you're all aware. Now, Russia, these are the number of cases they're reporting. These are the number of deaths they're reporting. Now, at a similar phase in the UK, it was looking like the deaths were about 10% of that. In Italy, it was about 14%. Now, we know that this is because the number of cases officially detected are an underestimate. So it makes the case fatality rate look higher. But if this is accurate in Russia, then that would mean the actual death rate is probably something like, I don't know, 20 times less than that, 0.05% or something like that. So this figure here, 1% of current deaths to formally diagnosed cases for Russia, makes no sense whatsoever. Absolutely no sense at all. I'll leave it at that. As I said, in Italy, at this comparable time, that was about 14%. In Italy, we know it's not that high. It's come down because we know of the undiagnosed cases. But that death rate compared to that number of official diagnosed cases makes no sense at all. There you go. President Vladimir Putin has said they are past the peak, which I'm delighted to hear. So I'm very pleased to hear that Russia is past the peak. I really hope is correct. New infections down from 11,000 in mid-May to 9,000 now, so that is encouraging. 174 deaths on Tuesday, and again, that death rate makes no sense. It should be way higher than that. Something is not ringing quite true. But President Putin has said he wants the Second World War victory parade to be held on the 26th of June. Well, if that happens, that will be guaranteed massive spread if that happens. Let's hope President Putin reconsiders holding a massive Second World War victory parade on the 22nd of June, because if he did, many people will become infected without any doubt. So let's just say there's data difficulties from Russia at the moment. War-torn countries now. Syria has 121 cases and 4 deaths. In other words, we have no data from Syria at all. This is poppycock. We have no data. That's the Johns Hopkins data, but it means nothing. So we have no data from Syria, I'm afraid. So what's going on in Syria, I have not got a clue. We simply have zero data. I have suspicions that it's quite bad. Lockdown loosening restrictions. Mosques allowed to reopen fully as of today. But official cases continue to rise. Unofficial cases, we have no clue. Syria's borders remain closed, which is probably good at this stage. War and pandemic, not a good combination. So I'd like to tell you what's going on in Syria, but no one, at least in the public domain, no one knows. I suspect in Syria they know they have a severe problem. I suspect they know there's a lot of community spread. I suspect they know a lot of people are dying. But I don't know. Lebanon, another country with many problems. Again, these figures are very hard to believe. It's got to be higher than that. Now, Lebanon taking this very seriously, quite big fines for anyone caught without anyone caught not wearing a face mask in public. Now, this is encouraging, but in actual fact, I'm not worried about people wearing face masks as long as they're separated by a 2 or 3 metre gap and as long as they're outside. That's not what I'm worried about. I don't think you're going to, or the probability of catching this virus through 3 metres of fresh air is very small. So it's not outside I'm worried about. What I would prefer to see is anyone caught not wearing a mask in an indoor or confined public space should be fined, or if there was any crowds outside, of course, like those crowded swimming pools in Missouri, was it, where people were that far away from each other, and probably that far some of the time as well. So yeah, good. I can see where they're coming from. Outdoors, I don't think it's necessary. Indoors, it certainly is, and I wish we were doing it in the UK and in the United States. And we saw that photo a few weeks ago of the mask dispenser, was it's compulsory on the public transport in Spain, for example. Why all of the US and all of the UK doesn't get on board with this is nothing short of bizarre. And indeed, I would go as far as to say amiss. I could have used another word. Amiss of the authorities not to act on this. 1 million masks in Lebanon obtained for public distribution. Excellent. So they have to reopen some of the economy. That's understandable. There has been laxed social distancing standards. Let's hope that improves. But malls, swimming pools, gyms and international airports remain closed. So that's Lebanon. Now, Yemen. Oh dear. This is not a nice story to tell. 259 cases, 49 deaths. That data means absolutely nothing. In other words, we have no data from Yemen. Population is 29 million. Most appalling war for the last, I've lost count. Is it 5 years now? 3.6 million people internally displaced. That means they're moving around. That means they're going to vector the disease all over the country. There is community spread now in Yemen. There is community spread. It is spreading with no epidemiological links. That makes these numbers look silly, that it's a mockery. Yet it's all John Hopkins has. Now, as well as the COVID-19, in Yemen there's currently outbreaks of dengue, hemorrhagic fever, the virus spread by mosquitoes, malaria, the parasitic disease spread by mosquitoes, cholera, the fecal-oral bacterial disease. All potentially fatal diseases in their own right. So they've got these plus COVID now. And when someone gets COVID-19 and they already have one of these infections, I don't know what the prognosis would be, because no studies have been done that I'm aware of comparing and looking at what happens if someone's got dengue then gets COVID, or malaria then gets COVID, or cholera then gets COVID. But whatever it is, I suspect the outcome is going to be bad. And this is going to, in my view, greatly increase the case fatality rate. Now, I hope research comes along and says that actually if you have dengue and you get COVID, you're no worse off. But I don't see that's going to happen. We know people that get COVID and influenza are quite a lot worse off. We don't want that. So many people in displaced situations, no running water in many circumstances, and already this morbidity going on in the country. More than half of the International United Nations staff have pulled out. So the United Nations staff working in the country, more than half of them are pulled out. And the United Nations are saying it's because they have no medical cover for their own staff. UN domestic staff do remain. So, unfortunately, I think there's going to be a lot of problems in dengue and a significant in Yemen with dengue, malaria, cholera, COVID-19. One thing we could do is supply them with large amounts of hand gel. That wouldn't do any harm. and everything else that they need. Let's hope that people can get their act together on that, get this war stopped or suspended, and these people that are dying can't be replaced. And everything that could be done is not being done at the moment. We must do more. So that's all I wanted to say today before I look at some pictures of my favourite people. So the problems are ongoing in Europe. They're going to be ongoing in the United States. Some areas the problems are accelerating. Places like South America, there's going to be huge spread and deaths in the next month. I don't see any way around that, I'm afraid. The virus isn't going away just yet. Right, let's look at some lovely people. And here we have Debbie, way down in the south of Australia. Now, Debbie, I'm sorry I don't know your dog's name. He's a great looking dog. Dogs are just great. They know what you're thinking. So thanks for sending that in, Debbie, South Australia. Great to know you're watching down there. Great country. This is Dick watching from the sunny state of Florida. So hopefully Dick can make plenty of vitamin D in the sun. Lovely sunny state of Florida. Thanks for watching, Dick. This is Dirk Peter in the Netherlands. Got quite a few viewers in the Netherlands, actually. It's interesting. If these videos were made in the Netherlands and it was someone speaking Dutch, then I wouldn't be able to understand a word. And yet I'm making these in England and Dutch people can watch them and understand them. Very clever linguists, the Dutch. So glad to know you're watching, Dirk Peter in the Netherlands. Thank you for watching. This is Dogan. And Dogan watches in Turkey. And he's got some vitamin D there. But hopefully he can get plenty of sunshine in Turkey as well. So that would be good. Great to know people are quite a few viewers in Turkey again. Great to know people are watching in Turkey. Quite humbling to know that people watch in so many places around the world. This is Donna and Robert in Kansas City. Watching on their tablet in Kansas City. Now, Kansas City must be in Kansas. My American geography is appalling. But great to know you're watching. Donna and Robert, thank you for watching. Kansas City. This is Douglas. I'm not quite sure what part of the US Douglas is in, but it looks like a very nice part. Although a bit of a stormy day. But great to know you're watching, Douglas, in the States. And I envy your view. It is quite beautiful. This is Dr. Johnny, who is in the Philippines. So delighted you're watching, Doctor, in the Philippines. And I do actually know, without giving away any confidences, you've had quite a busy time lately. So very pleased you took the time to send that picture in. That's a better one of you there, isn't it? There we go. This is another doctor. Samathi, am I saying it? I'm not saying your name right. I do apologise, Doctor, for saying your name wrong. But anyway, I'm delighted you're watching. I'll call you Samathi. It's close to that. And you also have very good taste in art and books by the looks of it as well. And I envy your tidy desk. I wish my desk was so tidy. But great to know you're watching. I'm not quite sure. Oh, no, I do know where you are. You're in Sydney. You're in Sydney in Australia. So great to know you're watching in Australia. This is Faris, who sent that in from Dubai. Now, I can't remember the name of this building, but I think it might be the world's tallest building. So good to know that Faris is watching in Dubai. This is Dylan and Jan in Ontario in Canada. And obviously they are working on making masks, which I'm delighted to see. Looks like just the briefest of pauses from the industrial activity by Dylan and Jan in Ontario. This is Eleanor, Sylvia and Mats, who watch in London, and the whole family has got quite excellent colourful masks. Well done to the whole family. This is Eric, who watches also in the Netherlands. So good to know you're watching in the Netherlands, Eric.